As many of you know, Yale is a well-recognized and well-recognized as an aggressive early adopter of new tech. As such, they have mature processes for finding, evaluating, and implementing new things on both the patient facing and non-patient patient-facing side of the business.
Thanks, Tom. Yeah, the big thing that pushed us in the direction of looking for a vendor in this space was really very simply just being able to know what's on our network. We had an internal audit where we found that we were lacking a little bit in being able to easily tell what was on our network and really what equipment we had. Our clinical engineering departments were sort of disparate across our several different hospitals, and we're combined into a system-wide team 7 or 8 years ago. So our CMMSs were still disparate as well. So this became an initiative to get everything in one place. And we're still working towards that in some ways, but in finding this solution, we've been able to not only find what's on our network, but also a lot of these other things like what stores and transmits PHI, what are our more vulnerable areas, and what devices do we want to focus on when we're thinking about replacement or upgrading of equipment, and other methods for improving on our security, whether it's using firewalls or segmentation, as well as being able to show executive leadership in a meaningful way what we're doing and what we're planning, and we're actually using information that we've gleaned through this technology to be able to show them physically what's going on.
New levels of visibility. It's no longer about device discovery and identification. Those aren't even today's table stakes. Let me put it to you this way. You should all expect your inventoried assets from a solution provider in this marketplace to be fully profiled, meaning specific attributes of the device, its configuration, location, network status as an example, security posture, and has been mentioned by both Steph and Amy, utilization. Because if that's in tow, your vendor can then focus on further enrichment and delivering automation. So beyond having the ability, as Joe mentioned, to instantly correlate vulnerabilities as an example and threats to potentially impacted devices, if you know all of this stuff, you can, for example, automatically generate remediation instructions that are appropriate. You can simulate risks and optimize your mix of controls. If you not only know how the device is supposed to work, its operating requirements, but know exactly how it is being used, then you can effectively monitor performance and auto-generate appropriate security policies. The list, really does go on, and this is where we live because we have no competing industry agendas. So what? Of course, the answer is, if the data quality is unquestioned and actionable, it's what you can do with it. That's where the value is driven, and that's where we're focused as a company. So Joe, I'll let you take it from here because you're quite familiar.
A lot of examples in here that we're taking advantage of, but it really does show how a solution like this allows us to bring all of the information that we can into one spot so that it can be utilized, as Tom said. So a few examples. We're doing a lot with our different networking tools. So, we've integrated with info blocks in order to get our DHCP information. We're doing a lot of SNMP interfacing to be able to pull in the naming and locations of our switches, as well as with Cisco Prime to pull in the access point naming and location information. And that enables us to, if something triggers an alert, or if we want to figure out where a device is for whatever reason, it's as simple as just looking on its profile in the system and being able to track it down. Whereas in the past, something would trigger an alert in one of our information security tools, and it would have an IP address, and that was really it. and Office of Information Security would reach out to individuals they thought might be associated to the device, and it would take a week or 2 weeks to figure out what was going on. Now we can pinpoint where those devices are and get it off the network, or upgrade it, or do whatever needs to be done to resolve that vulnerability. The other use for that Cisco Prime integration in the location of the devices is that we can utilize that for our PMs, for if someone puts in a ticket for a device, and you know the device information, but you don't know exactly what might be. It actually allows you to utilize this almost like a real-time location system. We're also integrating with our Palo Alto firewalls. Today, we're really just populating information in there so that we can eventually utilize that to lock things down more, because it's a continuous process. We don't want to just lock everything down and then it affect operations in some negative way. So that one's an easy one that we're monitoring how we want to use it. And we've also been looking more at how we can use this for looking at utilization of equipment. So we've integrated with our PAC system, and it's now analyzing each of our cases and the length the case took and how big the file might be, and we're utilizing that to start looking at scheduling of cases for mammography or MRI, and being able to make decision making on scheduling or replacement or other both capital and operational decisions. We're also doing, we don't currently have Cisco ICE in place, but now that we've have Medigate in place, we've been able to sort of push our networking team to accept, not only they knew this was important, but they were sort of scared of the large push that would need to be taken into place in order to implement ICE. So being able to have all this information available so that when they're there, they really can just push it in and activate it. It makes them more willing to take that big leap in going in that direction, which is so much more secure. So that's been a huge gain that we're currently working towards. And I mentioned our disparate CMMSs. We moved to a centralized CMMS a little under a year ago, and are hoping to integrate that really soon as well. So we can start populating Medigate with, in both ways, populating Medigate with information from the CMMS, as well as populating our CMMS with operating system versions and MAC addresses, IP addresses, things that may have been being documented but may not. Over the past however many years devices have been in our system, some are 15 years old. So it's great to be able to look towards being able to get all that information into that location. So we have a few different use cases. This slide is specifically showing our device utilization tool, looking at ultrasounds. So from this, we can see that there are 84 ultrasounds in our health system, if you look in the upper right there, that haven't connected to the network in the past 3 months. So, this is something that we can use to, someone's asking to get a new ultrasound. We can literally look and say, you haven't used one of the 3 that you have in however long. So we can use this to actually make that decision-making prioritization more valuable. So yeah, maybe they need a new one, but they don't really need it as much as the site down the street needs a new EKG or something like that. So definitely really helpful utilization information to be able to make those decisions. And on the clinical engineering side, which I'm a clinical engineer, so it's near and dear to my heart, even though I've been focusing so much on the security stuff. Adding in the RTLS information and the utilization information in one location makes it so we can see, okay, this device usually isn't used on Wednesday mornings as often. So if we need to get a 1 hour window when we can do our PM, maybe that's the time to swing by the unit and see if we can do the PM at that time. So it's just making it more visible to the people in the system to be able to use it that way. This is something I'm definitely going to be using in the near future. We're currently working on an infusion pump interop project with Epic. And this allows me to see where devices are being used. So we can determine if we need to deploy more infusion pumps to a certain area. And similarly with the PM information, when we do have that integration with our CMMS, if something's been tagged as lost or missing in the CMMS, we can send that information across to Medigate and show that here where, hey, maybe we can trigger an alert that this device that is supposedly lost or missing just connected to the network in whatever hospital. And we can, create a ticket back to the CMMS that would then trigger a tech to go in and take a look and try to find the device so they can properly do that PM that might be required.